Hello everyone. In this video, we will talk about all important drugs starting from alphabet B. So before starting the video, if you are new to our channel, please subscribe and hit the bell icon. So the first drug is baclofen. Baclofen is GABA analog, which is used in relaxation of spastic muscle. It is orally active and is spasmolytic, which activate GABAergic B receptor in the spinal cords. What are the other spasmolytic drugs? You should know. The spasmolytic drugs are divided into two types on the basis of their duration of use. Some are used for acute purpose like cyclobenzaprine, metaxalone, methocarbamol, or phenadrine, while some are used for chronic. The chronic use drugs act on CNS and muscle. The muscle acting drug is dantrolene, while CNS acting drug is baclofen, diazepam, and tizanidine. Next come after baclofen is benztropine. Benztropine is muscarinic cholinesterase blocker. It is centrally acting anti-muscarinic prototype for Parkinson's disease. Its toxicity include excessive anti-muscarinic effects. Next come botulinum. Botulinum toxin is produced by Clostridium botulinum. This enzyme cleave protein like synaptobremin and block neurotransmitter release, specialized neurotransmitter called acetylcholine. So they are injected to treat muscle spasm, smooth wrinkles on face, and reduce excessive sweating. Its toxicity include paralysis. Next come bromocriptine. Bromocriptine is ergot derivative, ergot alkaloid. It is prototype dopamine agonist in CNS. It inhibits prolactin use, so it is used in the hyperprolactinemia and alternative drug in Parkinsonism. Its toxicity include dyskinesia, hypotension, CNS disturbance. Next come bupivacaine. Bupivacaine is long-acting amide local anesthetic prototype. Prototype meaning representative and local anesthetic. In local anesthetic, it is included in amide. In amide, it is also long-acting. It has greater cardiovascular toxicity than most local anesthetics. Then comes buprenorphine. Buprenorphine is opiate. It is long-acting partial agonist of mu receptor. The other drug also include pentoxazoline, which is kappa agonist and weak mu antagonist, while nalbuphine activate kappa and block mu receptor. So nalbuphine and pentoxazoline are reciprocal to each other, while buprenorphine is partial agonist of mu receptor. Partial agonist of mu receptor. Okay, it is analgesic and effective for detoxification and maintenance in opioid dependence. Next come and the last but not least is bupropion. Bupropion is antidepressant drug and used in smoking cessation. Its mechanism is uncertain, unknown, but no direct action on CNS amines. Its toxicity include agitation, anxiety, aggravation of psychosis, and seizures in high doses. This was all about drugs starting from alphabet B. So please like this video and subscribe our channel for more videos. Thanks. Stay tuned.